Next up on the Last Visit First podcast, live from Home Care 100, Brian Lobley, President and CEO of Tango Health, formerly was known as PHCN. So welcome to the show, Brian.
Thanks, Tom, for having me. And thanks for Lincoln Healthcare for the support. I was able to speak earlier today and really enjoying the conference so far.
Yeah, it's been awesome. So what are you finding great about this conference? What are you here for?
Alignment. I think had a lot of opportunity to talk to different providers, especially on the skilled home health side. And I think there's universal alignment that we need to move the market to value-based. We're trying to do that here at Tango, but it's great being on kind of the healthcare side for over 25 years now. This is one of the sectors where I think all the stakeholders are aligned. I did not see that all the time in my past. So love that, whether it's vendors, service providers, at-risk entities, providers, everyone's really aligned to the same objectives. So that's actually refreshing.
It's awesome. So tell us what Tango does.
So we're Post-Acute MSO. So the business started here in Arizona as a home health care agency, actually, and then moved into managing and qualifying referrals, right? So kind of the idea obviously became, how do you make sure that referral gets staffed quickly? So business had this foundations as PHCN, and then Tango really kind of the pivot intentionally from a brand standpoint really is to move it into a value-based MSO. Focus on the home. So we're home first. Idea is kind of create a catcher's mitt, partner with a payer and say, hey, we'll ensure that your government-sponsored business, we do primarily Medicare Advantage and duals now, that will ensure you get timely access and then move that into a value base. So what we really want is our home healthcare providers rewarded for managing that episode. And we know one of the biggest things that add costs into the system is avoidable readmissions, avoidable emergency room visits. Well, those skilled home health nurses in the home, they're impacting that. So let's make sure they get rewarded for that. And, we've been on that journey now, and thanks to you as well, Tom, for your team's help in contracting and introducing a lot of great providers for us.
Yeah, the Maxwell Tech team works a lot with Tango, so it's been really great. Where are you guys doing business at?
So this is a really awesome story to share, right? So if we go back to January of 2025, we were managing, we like to think of Medicare Advantage equivalents. So we had over 1 million members, but we had about 480,000 Medicare Advantage equivalents. We were in Arizona, Colorado, Nevada, New Mexico. So a good foundation in the Mountain West. Last year alone, we added 4 new states, Texas, Oregon, Pennsylvania, and Ohio. That was about 330,000 members that we added. So all Medicare Advantage equivalents, really, really good year. Different parts. Some business came on, Pennsylvania in February, a little bit more in May. A bolus came in July, and then a little bit in fourth quarter. But we're really excited upon building on that foundation. Now, as we've turned the calendar year, we're going to expand another payer in Oregon just on 2/1. March 1st, so we expand into Michigan with 660,000 plus members.
Wow.
And then Tennessee, end of the quarter, another 220,000. So 900,000 lives just this quarter. So you think about that growth, I think it's showing that the model works and it's scalable.
What's different with the model? Tell me why people, if I'm a provider, I'm a home health agency and I want to work with you, what's really different?
Yeah, I think, you know this even better than I. You've been kind of tremendous helping me learn this business a lot more. But when you're a home health agency, you really have to think about your payer relationship. It's one to many, right? So if you want to have a contracting strategy, is it the same with a national versus a regional plan? Do you have to come up with something different? And maybe depending on what counties you're serving within a region or a state, you're like, oh, well, I do this really, really well, but I don't do this part. What we bring is kind of that chassis together. So we try to level the playing field on the payer side. The idea is land and expand. We don't want to have one payer in Texas. We want to get all the payers aligned. So for what Tango, I think we can do to the home health providers is ensure that not only are you getting a contract that rewards you holistically, we're actually stepping up earlier and we're managing that referral for hospital discharges. So we're qualifying it. We're making sure when you receive a referral from us, you receive an off. So there's not that waiting period. It's go. And really our objective is let you do what you do really, really well, which is care for patients. We don't want to get in the way in that. We want to enable that. So you've heard me say this, I brush back, kind of the convener title. We're not, we're an enablement platform. And I think that's really resonating both on the payer side, but especially on the provider side.
So in home health, I know through all my consulting work around the country, conversion rate from a referral to an admission is really, really low, in the 30s, 40s, 50%. Some agencies are even worse than that. What you're saying is you're going to hand me a referral, already talked to the patient, already told them they're coming to me, already ready to go. You're going to hand off the documentation details of that, and the patient's going to know that I'm on my way. That's the goal?
In
That's
Pennsylvania, easy. We went live back 5/1 with a very large payer, 120,000 lives, Independence Blue Cross. 100% of the qualified referrals are placed because
Wow.
we're making sure the order's right, the eligibility's right. You don't have to go chase that. You also don't have to get the jump ball at the discharge planning.
Yep.
We're going to send it to you and it's going to be qualified. So you're ready to go. You have the agency ready. You have the nurse ready. Go. The key for us is we really want to focus religiously on timely start of care. And you know this better than anybody. If you're in that home within 2 to 3 days post discharge, you're going to make an impact and that patient's not bouncing back into the hospital for unnecessary or avoidable readmit.
This morning in the conference, we were talking about that. The number one thing is, I mean, some of these patients are sitting 7, 8, 10 days before they ever get anybody to come see them. You guys are doing it within 48 hours. That's amazing. And you get 100% of the referral. There's tons of savings there. I'm not fighting the work. I'm not fighting the process. I'm not fighting the sales process. I'm not fighting the intake. I'm not trying to find a patient. I mean, we have so many patients in agencies that I work with where they get a referral and they never can find the patient. They have a phone number problem wrong. They have an address wrong. And so they spend all this time chasing a patient that never turns into a patient.
Yeah, I mean, it sounds great. You're like aligning stakeholders, right? And it almost sounds too easy. But yeah. I think when you see the model in place, it's like, oh, wait a minute. Okay, I don't have to fight for the jump ball. You're qualifying it for me. I can focus on what I do is getting someone into your home. And then from the payer, we just talked about this on stage, right? I was a payer for a long time, as you know. I had a different ancillary contracting team than like what I had in my hospital contracting team. And you just think of the dollars, right? You're natural in a payer. You're going to focus on inpatient spend, right? Oncology, ortho, cardio, all that kind of stuff. And then you unfortunately look at post-acute, home health, and in aggregate, it's really only 2% of the spend. If you just look at pure dollars, if you look at the tie of the dollars, it's much higher. So that's what we've tried to align it. And, I think the growth is showing that people are believing it from that standpoint.
I always say we got to make it easier to do business with Medicare Advantage payers. We got to make it easier. And if we can figure that out and we can take off the burden of the home health agency, if you're handing me a referral, that's got to be easier. Sure, we can't pay you everything that, that Medicare is going to pay you essentially. But if we can make it easier and add value to the patient and keep the patient out of the hospital, it's the right thing to do. If I'm in Michigan or one of the states you're expanding into and I want to get a hold of you and I want to be a part of this, what's the process?
Yeah, tangocare.com. Come visit us. We really are trying to build robust networks in every state we go into. So, we are not exclusionary, we're inclusionary, right? So the idea is kind of come in, participate, and we're going to allow you to see patients that you can provide value for. And then we try to get creative, right? We try to make sure, again, that administrative burden is simplified on your end. So I'd also say we want to collaborate and partner, right? So, we don't know everything. So we like those informed partnerships and ideation sessions as well. So I look forward to hearing from more providers in those markets we're going into.
All right. And I know if you're putting 900,000 patients on, you're recruiting a lot of people. People want to recruit if they want to come work for you. And this is a cool business. I'm really impressed with this business. How do they find you for that perspective?
Yeah, I mean, look us up on LinkedIn. As you know, Tom, a lot of hiring going on right now across all different roles. We have innovative roles on provider contracting, care coordination, obviously case management, utilization management. So big growth year for us. So look forward to having more people join the Tango family.
It's awesome. Thank you, Brian.
Thanks for having me. Really appreciate it.